This section is going to cover a couple of different things, some other type of bleeding disorders and seizure disorders. The first disorder that I want to talk about are called atriovenous malformations, and this is where in the capillary bed you just essentially have a tangled mass of blood vessels that are dilated and are producing abnormal channels between the arteries and the veins. You can have these anywhere, but they occur most often in the brain. They can be small and they can be very large. The symptoms a lot of times will depend on where they are in the brain and how large they are. The symptoms are going to include a localized headache in the area of the brain, dilated pupils, blurred or double vision, pain above or behind the eye, weakness and numbness, and then difficulty speaking. Other types of bleeding in the brain are going to be subarachnoid hemorrhages. These are not like hematomas. These are hemorrhages in the vessels of the brain that leak into the particular parts of the brain. They usually don't come from some kind of traumatic brain injury. Essentially here what happens is blood is going to escape from some kind of vessel that has been injured, and it will leak then into the space between the arachnoid matter and the pia mater in what's called the subarachnoid space. Individuals that are most at risk are going to be those with intracranial aneurysms as well as intracranial atriovenous malformations. Those with hypertension, the extra pressure on the vasculature of the brain can actually lead to vessel rupture. And those that have sustained brain injury or head injury. Blood is going to increase the intracranial volume and the intracranial pressure, and this is going to become irritating to the brain tissue. When this does, it produces an inflammatory response and then all of the steps of inflammation that occur, and this can lead then to the hemorrhage that will happen and cause the leakage into the subarachnoid space. Symptoms, when you have early manifestations, this is going to be associated with the vessel that is leaking, and they're going to be episodic depending on how much volume is leaking out of the blood vessel. If it's just a little bit, then these will come in waves that are farther apart. If it begins to leak a little bit more, then we're going to start seeing these symptoms happen closer together. Symptoms usually are going to be headache, changes in mental status as well as consciousness, nausea and vomiting, and neurological defects like issues in speech, maybe vision, those kinds of things. When we have a ruptured vessel, these symptoms are going to be sudden. It's going to be explosive, and the headache is going to be migraine numbing. A lot of times it's accompanied by nausea and vomiting as well as blurred vision, visual disturbances, certain motor defects, not having good fine motor skills, generally a loss of consciousness, and an extreme rise in intracranial pressure. Treatment and diagnosis are going to be based on the clinical presentations. How are we still leaking, or have we had that vessel burst? Usually they're going to use a no contrast CT scan and a lumbar puncture to see if you're bleeding into this cerebral spinal fluid. Atriographies are the best for diagnosis, and atriography is basically looking at the blood vessels, particularly the arteries of the brain, and so that they can, I'm sorry, not atriography, arteriography. They're looking at the arteries of the brain and seeing where they can see the leak. Treatment is going to be directed at controlling the intracranial pressure, improving the blood flow to the brain and brain tissue so that you can prevent any kind of hypoxic injury, any kind of ischemia, and then trying to avoid any kind of rebleeding. Sometimes we can have things happening in the brain that have nothing to do with bleeding, things like seizure disorders. A seizure is basically an explosion of electrical information that is moving through the neurons that is very transient. You can see alterations in brain function during seizure activity, and it's usually going to involve motor and sensory as well as autonomic and sometimes even psychic manifestations. convulsions a lot of times are going to accompany seizures. A lot of times you see this herky-jerky type of movement. These are what we call tonic-clonic seizures. The major seizure disorder that everybody is probably most familiar with is epilepsy. Epilepsy is essentially a seizure disorder where you have no discernible underlying cause. Usually what people will come to the conclusion is that it's a mixture of genetics and environment. So one of those multifactorial types of diseases. So if we look over here at this picture, you can see what a normal EEG looks like. This is basically a seizure-free EEG, normal waking EEG. Here is one that you have a seizure-free EEG, somebody with a seizure disorder and a seizure-free EEG. And then if we compare it to an epileptic seizure, huge amounts of brain activity, explosive information being sent everywhere in the brain that basically leads to everything being turned on all at one time. Think about turning your TV on and your stereo and your phone and everything up at highest volume and having it all on at the same time. That's kind of what happens in the brain of somebody with epilepsy. Clinical manifestations are going to depend on the type of seizure disorder. When we're talking about the symptoms, a lot of times people will have there are two types of generalized symptoms to tonic-clonic seizures, something called aura and something called prodroma. An aura is essentially just a partial seizure that comes right before the onset of a generalized tonic-clonic seizure. A lot of them will be like what we call myoclonic. Well, they'll have small jerking seizures that will precede a very major, what used to be called grand mal seizure, but is now called a tonic-clonic seizure. Prodroma is basically kind of an early manifestation of the onset of a seizure. A lot of people that have seizure disorders, they can see this feeling, or they can have this feeling coming on, and they can feel it usually hours to, potentially days before a seizure. Using these and knowing what your body does during a seizure can actually help these patients experience safety during a seizure, and it can prevent them from injuring themselves so they can get someplace like a bed or a sofa or something like that so they don't end up hurting themselves. EEG is going to be used for the diagnosis of the seizure. They can usually tell the type of seizure and determine the part of the brain. You can have what are called focal versus transient seizures. Focal seizures happen in one place, and then when you have the diffuse seizures or the transient seizures, they're happening all over the brain. Treatment involves basically correcting or controlling the cause of the seizure. If there is no seizure cause that's identified, then using things like anti-seizure medications that will stop the seizures or control them so that you don't continue to have seizure type symptomology. Okay, that's the end of this recording. So again, as always, send me any questions that you have.